Welcome back to Pain Diaries. Dr. Suzanne Manzi here. Next up, we're going to talk about ReActiv8, a neuromodulation device that is restorative for low back pain. Let's play a little video for a quick intro.
Mainstay's ReActiv8 is an implantable device designed to electrically stimulate nerves to activate key stabilizing muscles of the lumbar spine. Chronic low back pain consists of an ongoing cycle of muscle weakening, pain, and activation suppression of the core spine muscles by the brain. ReActiv8 is designed to stimulate the nerves responsible for contracting the multifidus muscles. The brain senses the muscle contractions, and in response can trigger restoration of muscle control. With the multifidus again providing joint stability, the continuing cycle is interrupted, facilitating a recovery from chronic low back pain.
So ReActiv8 has been great for patients with chronic low back pain, and Dr. Anthony Giuffrida will be joining me today from Florida. He's the Director of Interventional Spine and Pain Management at Cantor Spine Center at the Paley Orthopedic and Spine Institute. Hey, Dr. Giuffrida, how are you today?
How you doing, Dr. Manzi? Thank you very much for having me. Excited to be on.
Absolutely. I happened to be in his office a few years ago where I took part in a MedEd Combine event, a virtual reality medical education program that he helped develop. And now today, he's on my educational show about pain. So I'm excited to have him here today as he's been involved with Mainstay Medical for the past few years and has had success with this new restorative neuromodulation treatment for low back pain. So let's first talk about the difference between palliative treatments versus restorative treatments for back pain.
Yeah, I think this is great. And one reason that I really was attracted to Mainstay Medical and the ReActiv8 procedure is my background before I got into pain management is PM&R, which is physical medicine and rehab. So I'm all about rehabilitation with the patient, getting them into physical therapy, really helping out that patient try to regain their own strength. And unfortunately, the only options we had at that time were physical therapy, which is great, but obviously we know it doesn't work for everyone. So then we have to go for palliative treatments where we're doing injections or ablations or spinal cord stimulation. We're really not fixing the problem, if you will. We're kind of masking the problem. And patients did really well from this, but we'd always want to try to get those patients better. And now with ReActiv8 coming along, I kind of tell people it's another step above physical therapy and other therapies that patients do, where we can actually stimulate that multifidus muscle that really stabilizes the spine and get the patient not only feeling better, but their back actually more stable and the muscle stronger.
I really love the fact that, patients only have to use this device for 30 minutes in the morning, 30 minutes at night, and it's able to restore that function and the neural brain connection back to the muscle. And over time, the therapy is able to restore the neuromuscular function, the byproduct being reduced pain, and then the body's restored to its natural state. I do love that about this device too, because again, you can do all the physical therapy in the world. It's going to strengthen your back muscles, but how deep can we get it? And a lot of people have that atrophy or loss of the muscle that's kind of turned into like fatty tissue in the deep low back muscles called multifidi, which is what ReActiv8's trying to target.
Yeah, I couldn't agree more. A lot of patients look at me and say, well, is it something I did? Is it because I didn't strengthen my back enough? Is it because I was lazy or too sedentary? And it's really not the truth. The reason the multifidus starts to atrophy or fibrose is something called arthrogenic innovation. And for some reason, patients and doctors alike understand it a little bit better with the knee. When we have some knee pain, we all know in the medical world that we're going to get quad atrophy. And that's not because you're actively telling yourself, don't fire my quad, don't fire my quad. Your brain will actually overtake when there's a painful joint and say, don't fire the quad because it hurts too much. That's one reason we limp. It's not because we actively say limp on every step, right? Your brain does that subconsciously. So that also happens in your lower back. It actually turns off the pathway from your brain to those deep muscles, the multifidus, and you can't fire them. Even if you try to overcome, it's very hard to stimulate just those specific muscles that are the true stabilizers of that lumbar spine. So what we have to do is implant this device, like you said, 30 minutes in the morning, 30 minutes in the afternoon. I actually call it your own internal physical therapist, because it's doing what we're trying to do in physical therapy, but we're unable to because the wiring is all messed up. The other nice thing we've seen with ReActiv8 patients is that that wiring kind of gets restarted and reconnected, and your brain now can control those muscles 6 months, 9 months, 12 months out after the implant, to the point where there are patients out there that had severe back pain and they're not even using the device after a year, not because it didn't work, because it worked so well that the back pain has gone away, and those multifidus and your brain have taken over their natural job of stabilizing the spine without the need for the stimulator.
Yeah, I find it funny because I tell the patients that too, like with the studies that have been done with ReActiv8, the patients are like, please don't take it out. I don't want it out. I want to keep it because it's worked so amazingly well for controlling their back pain. And like you said, I also tell them, I'm like, I know you don't like going to physical therapy. This is, you can actually just lay there and push the button and it stimulates your back twice a day. I mean, a lot of people buy into it with that.
A lot of patients love the feeling. They say it feels like a deep massage. A lot of patients will even fall asleep to it at night. There are some patients out there that have done really, really well, but will still use it just because they like that feeling of support down there for 30 minutes a day.
Yeah, it's that unfortunate neural control that overtakes and creates a weakness type pattern. And that's why people just continue to tweak their back, because it's just like a feedback loop of negative reinforcement almost.
Yeah, I think one thing that we've realized now, and I've realized now that I've dove deeper into the world of multifidus, there's been studies about the multifidus out there since the 80s, and we knew it was a very important stabilizer in the back. You know, once it starts to atrophy and you start to lose that control, that's where a lot of the problems come from. The disc starts to take too much pressure now. The facet joints start to take too much pressure, and you end up with the stenosis. You end up with the radicular pain that we all know about. So a lot of people are saying, hey, can I have this put in before that even kind of gets down the road as palliative? And it makes sense, right? But the thing you need to realize is if you do still have that control set up, just the main thing would be is tighten up your core and tighten up your back yourself. Hopefully you won't need the implant in the future, but it is very interesting to think about, hey, can we prevent a lot of these problems that we see that are needing multi-level surgeries, multi-level injections? And I think we can, once we really dive into how well this works and how well we stabilize the spine with it.
Absolutely. Another question I've had, maybe you've seen this, as I know I have. Have you seen improvement in mental health with the patients that have had ReActiv8 placed?
I think the biggest surprise to me, and listen, I am a data-driven guy. All physicians are data-driven, but then we all have our own anecdotal evidence of our patients, how they do. My first few patients just wanted to be able to get off the couch and go to the bathroom. Like, this is what they were saying. I have so much pain just getting up off the couch, or I can't even brush my teeth. It goes so much further than that. In the first 3 months, they're doing all that. And now that they're a year and a half out, they're so energetic. They're moving around better. The number one thing I hear from patients is my whole family notices right away how well I do it. And I think that comes back to your point. The mental health just clicks. When you don't have back pain, it really kind of opens up a lot of avenues to what you can do. I actually tell a lot of my patients, the number one thing I think we take for granted, as we all do, is our health first and foremost when we are healthy. But second, back pain can shut you down. Everyone has all grand plans in the world. When you have back pain, and every day when your feet first hit the ground, you have that back pain, it can really get you depressed, get you anxious about doing anything out of the house, because you're just wondering, when's that back pain going to come? So the fact that we can really get rid of that back pain, give those people their life back, is impressive. And even for me, I mean, we do a lot of procedures, injections that work for 2 to 3 months, and people are happy, but they go through these waves, right? And sometimes we think that could actually make their mental health worse, because they get better, but they're just waiting for the shoe to drop. With this procedure, if you look at the graph, they really just keep getting better, even, we're at 4 years out now, I think, on the first studies. And those people are energetic, ready to go. Whenever you meet a patient with a ReActiv8 device and that's been in for 3 or 4 years, you can just tell, like, there is no back pain, is not even a thought in their mind.
Yeah, I love that. How do you usually explain the device to patients?
Yeah, so I do tell them it's an implantable device. I tell them we have to just do a small surgery where there'll be 2 incisions, one for me to put the leads in, in order for me to put the battery in. It is a very safe procedure in my mind. We're not going into the spinal cord like we do with some other stimulation device. So there's not really a huge chance of any nerve injury or even nerve pain afterwards. So a lot of patients enjoy that the risk is less than we'd say a spinal cord stimulator. The one thing that people will say, maybe I don't want to go for an implant right away. And I know we've been in talks with Mainstay about trying to even make things smaller for patients. And that's where the world of medicine is going. The battery's smaller, the incisions will be smaller. But every patient that's had it, I haven't had a single patient that said, this implant has been bothering me, because the pain relief is so great that the trade-off of having the small 2 little incisions and have the battery placed outweighs, or having the pain relief outweighs any side effects of that. So I tell patients it's a location we know we go all the time with injections. It's a very safe location and a very quick and safe procedure.
Yeah, I always tell them it's behind the spine. It's on the back of the spine, on the bones. It's not into the canal. And that does alleviate a lot of the, quote, fears that people have with, implantable devices. And yeah, the incisions are small, but again, they'll probably get smaller in the future as, technology continues to advance. And I know Mainstay Medical is on the cutting edge of advancement of treating pain. So thank you so much, Dr. Giuffrida, for being with us today here on Pain Diaries. Anything else you'd like to add?
No, this is great. Thank you very much for having me. I love the virtual stuff, so I think it's very cool to be able to do any kind of education or teaching or anything virtually. I think that's where the world's going, and I enjoy this a lot. Thank you.
Absolutely. I'm glad you were here, and here we are educating the world about pain management. Thank you. We'll be back on Pain Diaries. Take care of you so you can take care of business.